the significant progress came following the work of the Pasteur when British surgeon Joseph Lister began experimenting with the using phenol during the surgery to prevent infection. So Joseph Lister is the first surgeon who used the phenol during the surgery to prevent infection. The Lister was able to quickly reduce the infection rate, a reduction that was further helped by his subsequent introduction of technique to sterilize the equipment, have rigorous hand washing, and a later implementation of double glue. So, firstly, he used phenol during the surgery, and then he used to sterilize the equipment, have a rigorous hand washing, and later implementation of the rubber gloves. Where is the other student? Hmm? You are not able to.
मॅम मेसेज मॅम मेसेज केला आहे मी.
Okay. So Lister published his work as a series of articles in the Lancet, that is in the March 1867, under the title that is Antiseptic Principle of the Practice of Surgery. So, in the March 1860, the Lancet titled The Antiseptic Principle of the Practice of Surgery is a very important work published in a series of articles. The work was groundbreaking and laid the foundation of rapid advance in infection control that saw a modern aseptic operating theaters widely used within 50 years. So Lysis himself went on to make further strides in antisepsis and asepsis throughout his lifetime. So he is the Horace Well and he is the William Morton. That is from 1815 to 1848. He do the management of the pain, that is control of the pain. Modern pain control, that is anesthesia, was discovered by the two American dental surgeons, that is Horace Well and the William Morton. Then John Snow. At the beginning in the 1840s, surgery began to change dramatically in character with the discovery of effective and practical anesthetic chemicals such as ether and chloroform. Later pioneered in the Britain by the John Snow. So, ether chloroform is very important for the controlling the pain. His pioneer is the John Snow. For relieving the patient suffering, anesthesia allowed more intricate operations in the internal organ of the human body. And in addition, the discovery of the muscle relaxant such as curare allowed for the safer application. That is John Snow. So, when there is a muscle relaxant that such as curare which is allowed for the safer application, then for these the internal organ operation is very useful for doing this as for relieving the patient's suffering by giving the anesthesia. So John Snow have a very important contribute in the field of medical science, that is he found the ether and the chloroform. Then a few general type of the surgery, that is elective surgery is the not only needed to save the life of the patient but is expected to provide some other benefit. Emergency surgery is a surgery which must be done quickly to save life, limb or the other capacities such as eyesight. Exploratory surgery is for investigating a patient's medical condition or making a diagnosis. So there are elective surgery, emergency surgery, and exploratory surgery. Then therapeutic surgery is for treating a patient, and surgery may start out as exploratory and become a therapeutic. Then amputation involves cutting of a body part, for example, limb or the digit. So in the surgery, the amputation is performed, that is cutting of the limb or the digit. Then replantation, that is an often difficult type of the surgery, more recently developed, involve and reattaching a severed body part. So when there is a cutting of some body part, so replantation is done to reattaching a suffered body part. Then reconstructive surgery, that is reshaping of certain bodily tissues including bone, cartilage, muscle, fat and skin that have been previously damaged by the trauma or are congenitally abnormal. So reconstructive surgery is very important for the cartilage, muscle, fat and skin damage. So this is a diagram. Here we can see how the reconstruction is done, that is skin graft. Then this is a congenital anomaly, that reconstruction is done of a congenital deformity of the hand. Then a cosmetic surgery. Here we can see the cosmetic surgery of the eyelid and the lifting of the face. So cosmetic surgery is a common type of the elective surgery that is done to improve the appearance of the patient. Then excision is the cutting of an organ or the other body part from the patient. So ancient circumcision set. So this is the ancient circumcision set in which there is a cutting out of an organ or the body part from the patient. Transplant surgery is the replacement of an organ or body part by insertion of another from different human or animal into the patient. So removing an organ or body part from a live human or animal for the use in transplant is also a type of the surgery. So here we can see there is a kidney transplant. So transplantation is also a type of the surgery. Minimal invasive surgery, which involve a smaller outer incision to insert some sort of endoscope, which is tube-like equipment to perform surgery. There are also many types of the more specific surgery. So, minimal invasive surgery involve endoscopy. In that, there is a minimal invasion of endoscope into the body. Then, laser surgery. Laser surgery involves use of the laser for cutting tissue instead of the scalpel or similar surgical instrument. That is here, a laser treatment is useful for the surgical conditions. Microsurgery is a fine surgery with the aid of a microscope for the surgeon to see bone. So when there is a microscopic structure is present, then their surgery is done by using a microscope. So, microscope for surgeon to see a better result. Then, a bariatric surgery. Bariatric surgery is a class of surgery for treating obesity, a common example of which is gastric bypass surgery. Bariatric surgery is a class of surgery for treating the obesity that is a common example of which is the gastric bypass surgery. Surgery is also used for the sterilization to prevent reproduction, although it is a rather simple procedure for the women. Then conditions treated by the surgery. Surgery is used to both as a treatment and as an aspect of the treatment for many conditions include physical trauma, for example wound, anatomical abnormalities and disorders of the function, inflammation, ischemia and infarction. So there is a metabolic disorder, neoplasia and other abnormalities of the tissue growth. For example, cyst, then hyperplasia of organ hypertrophy as well as some cancers. If caught early, there is a deformity and a heavy scar, brain damage and the nerve damage. So, the conditions treated by the surgery include the many types of the diseases, that is wound. For the wound, when there is an anatomical abnormality is present or disorder of the function, that is physical trauma. And when there is an inflammation of the any organ with the ischemia, that is loss of blood supply and infarction with the metabolic disorders and neoplasm, as there is a neoplasm, tumor, cyst, hyperplasia, organ hypertrophy, cancer, deformities, heavy scarring, brain damage, nerve damage. Then these cases require surgery. But it is not that these cases are not treated by the homeopathy. When it is a reversible pathology, then we can treat such a cases with the homeopathy. But homeopathy has some limitations for treating the surgical conditions. But homeopathy is useful before the surgery and after the surgery. As when there is a controlling the pain, bleeding, infection, then homeopathy is useful. As for controlling the bleeding, we can use the arnica 4 hourly before the surgery and even after the surgery, after hysterectomy, episiotomy in gynecological cases. Then, for controlling the fright, fear, anxiety before the surgery, we can use aconite. That aconite, gelsemium, and the many other remedies are indicated for such cases. And when there is a nausea, vomiting due to the post-operative, that is, it is a complication or the side effect of the anesthesia, that is nausea, vomiting to the patient. That in that cases we can use a phosphorus, then arsenic album, ipecac, and the many medicine. Then, when there is a flatulence of the abdomen after the surgery, in that cases we can use carbovage, synchona officinalis, colocin, and rapamycin. And when patient come with the swelling, stiffness, pain, bruises, and soreness, then Lidum pal, Rustock, Arnica, Calendula, Staphylococcus, the many remedies are available in the homeopathy to treat such cases. And for the abortion and miscarriage, we can think of the ignatia. In scissors and episiotomy, along with the arnica, we can think about staphysaria and Belispus. Then in DNC cases, that is in dilatation and curettage, the belladonna is useful, and in hysterectomy, the causticum is useful. Also in the orthopedic cases, ruta, lidum, lidum palm, stroke, arnica, calendula, staphysaria are the useful remedy. And when there is a heavy scarring, that heavy scarring is, can be treated with the thiocinamide. So there are the many homeopathic remedies help for such a cases before the surgery and even after the surgery. So to stop the post-operative bleeding, the syncona officinalis, ipecac, sickle cord are the many remedies are used. So homeopathy is useful in many surgical cases like cardiology, pathology, nephrology, gynecology, psychology, neurology, and surgery. So, homeopathic medicine used before and after surgery has been found to protect the patient from the shock, pain, bleeding, and other effects of the surgical intervention. And homeopathy is able to eliminate the unpleasant effect of the anesthesia. So, we can stop here. Have a good day. And today we are continue with this topic.